morning, everybody, and thank you for coming. And I know there's a great event next door, and a lot of you came over. And congratulations on receiving some grants from the Grossmont Healthcare District. That's a big deal, so it's good for you all. I'm Bob Kelly. I'm the president, CEO, and the originator of the idea of having a senior foundation here in San Diego. We also have a couple of people here who are also founders with me. There's Ted Chan over there. He's the chair of the board of the Senior Foundation, and he's been with the whole Senior Foundation since the very, very beginning. Went over to his offices, said, "Hey, Ted, I have an idea. I'm going to start a foundation. Would you help me?" And he did. And he's the chair of the Emergency Medicine Department at UCSD, a professor at UCSD. And Jerry Ray, he's our chief financial officer. He's been involved since before day one. So we're very pleased to be here. And we're going to talk about our new State of the Seniors report, which is, from our understanding, is probably the only one that's ever been done. And even not just here in San Diego, but we can't find one in the United States. So, which is really interesting when you think about how many seniors there are in the United States and in San Diego. So we're really excited to be able to debut this for San Diego. So the purpose of the San Diego Seniors Community Foundation, when we originally started, was three things. One is to build the awareness and the common knowledge of the issues of the growth of seniors here in San Diego and throughout the United States. We have all sorts of numbers in here. You'll be able to see all the numbers, but you know, San Diego, a few years ago, we had 250,000 people over the age of 65. Now we're up to about 750,000, and soon, in the next 5 to 10 years, we could reach 1.25 million. And the second purpose of creating the awareness, happening in terms of the Senior Foundation, is to do something about that. Now, how are we going to deal with all of the seniors that are here in San Diego and coming to San Diego, including people moving here, because people want to, and so you get a lot of retirees that are moving here in San Diego. We're not ready for all of that. We don't have the infrastructure. So our second big focus is to build the infrastructure and support. And in the last few years, we've really been supporting senior centers and helping build their support and their staff and their programming. The third is to increase philanthropy. It's to get more support for seniors. Our research has shown that almost less than 3% of charitable dollars in the United States go to seniors, which is pretty remarkable, but it's truly understood because seniors weren't an issue before. Because when they age, hit 65, you retire, and basically you would end up passing away sooner than later. But with the advances in medicine, the advances in drunk driving laws, seat belts, all of that, people are living longer and longer and longer. And society hasn't reacted to that yet in terms of building the infrastructure. I related to the late 1800s and early 1900s when we had a huge demographic change of children. People had large families, immigrants moving in from all over the world, and they were moving to cities, and the infrastructure wasn't there to support the kids. So what did society do then? They invented the Boy Scouts, the Girl Scouts, the YMCAs. They even invented playgrounds. That really wasn't a big deal until that period of time. Libraries. Andrew Carnegie went out and developed libraries all over the United States. Why? To support the kids. So it's now time for our society to start building the type of infrastructure necessary to deal with all of the seniors. The other part about this is take a program out of biology. I took a bunch of biology classes at UCSD, and there's a whole thing called the lily pad effect, and it talks about, and the whole thing is a visual kind of understanding on how diseases progress, how infections progress. And basically, if you ever think about it, if you've ever seen a lily pond in the spring, you see it's one lily, okay? You go by the next day, there are 2 lilies. You go by the next day, there are 4 lilies. Then the next day, 8 lilies. And so over the course of about 30 days, at the end of the 30 days, basically the lily pond, there is no pond, it's just all lilies. And it's because right in front of your eyes, you see the day-to-day changes, but all of a sudden it hits you. And that's in the lily pond, when you get to day 28, 29, and 30, so 28, it's a quarter of the pond, but it doubles the next day. So it's half the pond, and it doubles the next day. So by day 30, it's full. And that's the same thing that's happening. Right in front of our eyes, the senior population in San Diego is growing, but we don't really notice it. And we'll notice it 5 years from now, 6 years from now, when all of a sudden 1.25 million seniors here in San Diego. So we're really excited about doing this. We want to increase the awareness. We want to increase philanthropy to be able to support that. We want to get ahead of the curve. We've been very, very fortunate to have a couple of foundations here in San Diego. The West Foundation, which is one of the few foundations in the United States. We think there's like 5 to 7 foundations in the United States that are dedicated or partially dedicated to help seniors. We're fortunate. We have the West Foundation here in San Diego, which is 100% dedicated to seniors, and we have the Sound Family Foundation, and they have 1/3 of their monies go to help seniors. We've been very, very pleased and thrilled that they've been supporting us over the years, and we're here today because of them. Now, today, or about 3 weeks ago, the Grossmont Health District joined us, and they're supporting us in our new endeavor. Paul Downey's going to talk about that in a little while, but I want to introduce Randy Lennick, to come up and say a few words from the Grossmont Health District. He's the chair of the board. Thank you.
Thank you, Bob. I always get nominated to follow great public speakers. I appreciate that. Welcome. This morning we've had a great morning already. I know this is going to be a great press conference. On behalf of the board of directors of the Grossmont Healthcare District, welcome. Several of our members are here. Nadia Farjud-Campillo, Virginia Hall. I'm Randy Lennick. Bob Ayers was here earlier. He had to leave. And Maggie Watkins is out of town today. But, we all welcome you here to our district headquarters, and it's a fine place. I was asked to speak a little bit about the district, sort of the history. One of the things I know Virginia complains about it all the time. Nobody knows who we are. They all think we are the Grossmont Hospital, and there's a reason. Because 70 years ago, when the state of California passed appropriate legislation, the citizenry of East San Diego County decided to create the Grossmont Hospital District to build them an acute care hospital. And in 1955, the doors opened, and you all see it, it's across the highway. It's now a 560-bed acute care facility with all manner of services and programs, and getting better every day. So the district did its job for many, many years. Around about 1991, our predecessors, the district directors back then, realized that healthcare had gotten very complicated. Too complicated for a bunch of citizen executives, and too complicated for a simple little people's hospital in a fairly rural area of the country. So they combined with Sharp Healthcare and leased the hospital. And so now, even though it's still the People's Hospital, and we are the trustees of that facility, and we oversee its programs and its quality and the facilities themselves, Sharp Healthcare runs it. And quite frankly, I'll just sum it up. Sharp Healthcare has taken Grossmont Hospital from an average, run-of-the-mill community hospital to a highly performing one, and we're all better for it. So what happened to the district? Well, we went from being a hospital district to a healthcare district, and we transitioned from running a hospital to just supporting the hospital and overseeing it as the trustees for the public. We still support the hospital with strategic grants. We've supported the comprehensive stroke program, the GPATH in the emergency room, which diverts behavioral health patients out of the mainstream of the emergency room into a more a care center that's focused on their needs, and many other things. Not to mention, 20 years ago, the citizens of East County voted again to provide a major funding source for the upgrading of the hospital through the Prop G bond. And the healthcare district oversaw that $240 million expenditure, which combined with Sharps was almost $500 million in improvements at the hospital over the course of about 14 years. That was 20 years ago. I don't know, we're probably looking at maybe having to do another one because we still have to meet seismic requirements and the hospital is not completely seismically compliant. That's the hospital. The other thing that we transitioned into when we became a healthcare district, and you saw it today, and that is that we provide grants to our community healthcare network of providers to expand their ability to provide, particularly meeting those unmet healthcare needs that aren't serviced in the acute care setting. They need to be serviced in the community, and a lot of times it takes a little bit of juice from a public agency to encourage somebody to come out into East County and provide that service. And many of you here today represent that, and we want to thank you for that. The other thing that the healthcare district recognized quite a while ago is the need for the healthcare workforce of the future. And we branched into that. We have scholarship programs. We have programs in the high schools where we educate our high school students about the opportunities in healthcare. And it's not all just doctors and nurses. It's a whole city in healthcare. And there's a lot of opportunity for our youth. We provide scholarships to actually many of our nurses to expand and to become physician assistants and the like, to specialize in healthcare that we have a shortage of or whatever. And we're going to expand that even more now with the arrival of our new CEO, because James Sly kind of focused a lot on that with the East County Economic Development Council. So we're excited about that. And I guess with that, I've pretty much summarized who and what the Grossmont Healthcare District now is. Have I left anything out? All right. Well, with that, I guess I will turn it back to you, Bob.
Hey, thanks, Randy.
Thanks for the opportunity.
Yeah. That brings back, Randy, that brings back memories. I was part of the management team at Sharp Healthcare that was part of the merger. And I ended up running a bunch of the programs here, including hiring Jeff Martin.
Oh, that was great.
Yeah, she was.
I did forget to say one thing.
Okay.
You see, so this thing, longevity, what a neat term.
No, good.
I never really thought about that too much until now I'm 73 years old, and that word is really important. If you're 23 or 33, you're probably, okay, it's a notion out there. But when you get to be our age, it's a big
Our age. Beach, I'm 77. Now I want to introduce Paul Downey. We are incredibly fortunate to have Paul Downey join us. Paul, quote, retired about, what?
10 months ago.
10 months ago. Literally within a month, he got bored. And we're very, very fortunate that Paul was willing to join us in his second career. Paul, as you know, started the serving seniors in downtown San Diego. At the time, very small agency, and Paul built it into unbelievable success. And building low-income apartments for seniors, running meal programs, multi-million-dollar program. And so again, Paul has joined us, the Chief Advocacy Officer for the foundation. So he's going to get up here and tell us all about this stuff that you've been hearing about. Okay.
All right. Well, thank you very much. We're so delighted to have you with us. And so I'm going to talk you through what we're doing and kind of deliver, I guess this is the formal State of Seniors address for San Diego, the first one ever. So in San Diego, we are standing on the brink of a pivotal transformation as our senior population expands, presenting us with both unprecedented opportunities and urgent challenges. Decisions that we make now across policy, philanthropy, housing, healthcare, and transportation will shape how this region ages for the next half century. As adults 60 and older become one of San Diego's fastest growing groups, Their well-being and engagement are critical to the social and economic fabric of our community. Demand for senior services is rising. The cost of living continues to climb, and long-standing community support systems are showing strain. The state of San Diego seniors is at a precarious crossroads. Good work is absolutely being done in our community. There are folks here that are doing that work. And there's still time to bolster our systems. But the demographic realities of dramatic increases in the number of older adults, along with economic insecurity on the rise, means the clock is ticking and we're pretty close to midnight. I'd like to share just some data to illustrate what I'm talking about. As Bob noted, we're over almost 750,000 San Diegans are over the age of 60 as of the end of 2025. By 2040, that's going to be well over 1 million, with 100,000 folks 85 plus. By 2034, the number of older adults will outnumber the number of children. 2 in 5 seniors don't have enough money to meet their basic needs, about $30,000 a year. And I'm talking about housing, healthcare, food, and transportation. Nearly 1 in 3 people on our streets in San Diego County is older than 55. And more than 2,400 folks, seniors, became homeless for the first time last year. San Diego seniors lost about $140 million in elder scams. But that's an undercount, because many folks are too embarrassed to go to the police or the FBI saying, I lost my life savings. About a third of seniors are socially isolated, meaning they have no family or friends. And that raises the risk of dementia by 50% and early mortality by 26%. California is projected to face a shortage of 3.2 million direct caregiver workers by 2030. And that's going to create enormous challenges for families who need caregivers and increased pressure overall on our healthcare system. In 2026, the projected nursing home costs for a single room is $563 a day, or over $200,000 a year. If you need in-home support, a care worker earns between $30 and $46 an hour. So the San Diego Seniors Community Foundation is making some very specific recommendations. First, there is an urgent need for coordinated action among the Aging Services Network, including nonprofits, philanthropy, and government, to address these complex issues. And that means building coalitions that cut across silos. We need to standardize best practices, we need to share data, and ensure that no organization is operating in isolation. We need to prioritize aging as a central focus in community planning. And we need to ensure that older adults are supported, included, and empowered in that process. City and county leadership must integrate senior voices into decision making, and we need to create age-friendly communities and ensure that all new developments in transportation ensure that they are designed with mobility and accessibility in mind. We need to make data-driven decisions to shape policies on how we allocate resources that will secure health, stability, and opportunity for older adults. And that includes leveraging demographic trends to forecast services and housing needs. We need to collect real-time feedback, and we routinely, and I emphasize, routinely need to assess, are these programs doing what they were supposed to do? Are we investing our dollars wisely? We need to invest in affordable and diverse housing options for seniors, including supportive housing and programs that allow folks to age in place. That's what they want to do, and that is the most economically viable thing for us as a community to have them do. We need to expand rental assistance programs, home modification grants, and the development of intergenerational living models that can help address housing instability and reduce the risk of homelessness among older adults. We need to expand access to healthcare and supportive services by strengthening partnerships with local clinics, hospitals, and social service agencies. Mobile health units, telehealth initiatives, and culturally competent care providers can better reach isolated and underserved seniors. We need to protect seniors from abuse, fraud, and financial exploitation by supporting public awareness campaigns, training frontline workers, and ensuring accessible reporting and response systems. And collaboration with law enforcement and financial institutions is a must so that we can strengthen prevention and intervention, education and workforce participation for those seniors that want to remain active in the workforce. Lifelong learning initiatives and flexible employment opportunities can improve their financial security and contribute to the region's economic vitality. We need to promote awareness and understanding of ageism by educating people on its impact and encouraging inclusive behaviors towards all age groups. Now marks a pivotal moment. The San Diego Seniors Community Foundation is thrilled to announce the launch of our ambitious $2 million Longevity Fund campaign. This bold initiative is designed to establish a groundbreaking longevity club here in East County and to provide substantial grants to existing senior centers, empowering them to elevate their longevity-focused programming and services. And this transformational effort would not be possible without the incredible support of our partners. We first of all extend our heartfelt gratitude to the Grossmont Healthcare District for its generous $250,000 grant, which is the catalyst for this campaign. And thanks to their belief in our vision and the invaluable backing from the Psalm Family Foundation and West Health, I'm pleased to announce today we've already surpassed the $500,000 mark in the campaign. Together, we're building a momentum towards a brighter future for all older adults in our community. Now, you probably are wondering, what exactly is a longevity club? This is a longevity club. I want to be clear. It is not your grandma's senior center. We are looking to do a revolutionary reimagining of what it means to age well in today's world. The Longevity Club turns the traditional model on its head, creating a dynamic, welcoming environment completely dedicated to supporting the physical, mental, and social well-being of older adults. Picture a space, you actually make the picture, you can see it right here. A space with state-of-the-art fitness centers and tailored classes, a hub of lifelong learning opportunities, things like arts, technology, travel, finances, and a whole lot more, all designed for the purpose of inspiring, educating, and enriching. But it doesn't stop there. The Longevity Club is meant to be a place where older adults truly belong, a gathering place to spend meaningful time, to connect with their peers, and to form new friendships. There'll be dedicated case managers to help members navigate important resources like Social Security, Medicare, and housing, ensuring that every individual feels seen, heard, and most importantly, cared for. Together with your support, we can redefine aging in San Diego, empowering every older adult to pursue their passions, stay healthy, and live their fullest, most joyful life. So we're inviting the community to join this campaign. So if you'd like to do that, you can go to our website, SDSCF.org/longevity-fund, or you can just scan the QR code. It's probably easier to do. So with that, in just recognition of just the tremendous support from the Grossmont Healthcare District, it is now my pleasure to introduce Grossmont Healthcare District Board Member and Chair of the Community Grants Committee, Nadia Farjoud-Campillo.
Thank you.
Nadia.
I don't know about you all, but I want membership in this company. This is really incredibly exciting, and it's a pleasure to be with you today in this space, which is one of the a handful of healthcare libraries in the country. To Mr. Kelly's comments earlier, I think we're all invested in this. I think I'm the millennial in the lineup, and I hope our collective destiny is to become Lilies. We all care about that. We should all care about longevity, and that's why I'm so excited to be here with you all today. My name is Nadia Farjoud-Campillo, and it's an honor to serve on the Grossmont Healthcare District Board and as chair of our Community Grants Committee. 30 years ago, the district launched one of its most meaningful and enduring commitments, our Community Grants Program. This program was founded on a simple but powerful idea. Public health is not confined to the walls of a hospital or doctor's office, but it's practiced in our daily lives, in our schools, our parks, our libraries, our farmers markets, and our community centers. Since 1996, the district has invested nearly $41 million in organizations that support mental health and addiction services, expand access to nutritious food, help prevent and manage chronic disease, train the next generation of healthcare professionals, and ensure, as we're talking about today, that our seniors can live with dignity and connection. At the heart of this program is a commitment to working with our community partners to achieve our shared mission of a healthier, thriving East County for all. This past year, we were proud to build on this 3-decade legacy of community support with a historic commitment. The district has provided $4 million of grant funding, our largest investment to date, to support health and wellness projects like this one across East County. This 166% increase in our funding commitment reflects our recognition that, especially in face of the federal cuts we've all seen, we needed to step up and meet this moment with urgency and intention. We received 85 grant applications from many grantees who are in the room today and joined us earlier, totaling $9 million in requests, highlighting the significant need across nonprofits that serve East County. I am grateful to my colleague and partner on the Grants Committee, Director Maggie Watkins, and our incredible team at the Grossmont Healthcare District, including Amy Abrams sitting here, Justine McQuaid, Adi Rojas, and Randy Baker, who carefully reviewed these applications and helped us to support 51 grants. One special application jumped off the page. It was submitted by the San Diego Seniors Community Foundation to support this East County Longevity Hub you just heard about, an innovative project that reframes how communities view and value aging. This effort reflects an evolution in how we view senior care, not just in treating illness and being reactive and responsive to disease, but in promoting holistic health and wellness across the trajectory of life. This project reimagines what it means to age in our community by supporting older adults across 7 pillars of health and well-being, which helps them to not just live longer, but to live better. We are thrilled to collaborate on this project to support East County's approximately 80,000 older adults. As we heard from earlier today, one of the fastest growing populations in the region, 27% of whom live at or below the federal poverty level, and 35% of whom have a disability. This project also addresses a key gap in services, as there is only one, as in uno, no more, senior centers across all of East County to meet the significant needs of its diverse older residents. Initiatives like this Longevity Hub are sorely needed and represent the very best of our community grants program, rooted in compassion, guided by the data and figures we heard about earlier today, and driven by a sincere commitment to improving community health. And as we move forward, the district will continue to listen carefully to our community, to invest intentionally in impactful projects like this one, and to ensure that the funds entrusted to us by the taxpayers translate into healthier outcomes for East County residents. Thank you so much.
And it's now my pleasure to introduce Dr. Ted Chen, Chair of the San Diego Seniors Community Foundation Board. Dr. Chen is a professor and chair of the Department of Emergency Medicine at UC San Diego.
Thank you, Paul. It's a real pleasure to be here today on this very important occasion. As you know, as you've all heard, our population is aging rapidly, and with that comes challenges for us as individuals as we grow older, and for our community. As the body ages, we are at greater risk from physical injury, from falls, and medical elements like cancer and heart disease, and mental health issues because of social isolation. As an emergency physician, I see these challenges with our seniors firsthand. Nearly a quarter of the patients I see in our emergency department are actually over the age of 65. That's more than double the proportion in the general population. That's no doubt true for the emergency department here at Grossmont, where many of our former graduates and trainees now practice and provide care for East San Diego. And nationwide, there is one emergency department visit for every 2 seniors in this country every year. It's an incredible rate of healthcare need. As you know, healthcare is facing an affordability crisis. With cuts looming to some of the federal programs and even state programs, this issue is going to hit seniors particularly hard, those who need healthcare most in our communities. But there are ways to address these challenges. Studies show that regular fitness and exercise can reduce frailty among seniors. Social engagement activities and initiatives can address isolation, cognitive decline, and mental health for people in their 50s and 60s like myself, 70s, 80s, and 90s. And we're seeing a lot of those patients now in our emergency department. So that's why this initiative, the Longevity Fund, and the initiative to build the Longevity Club, which I'd like to be a member to as well, are so important. They're going to address the healthcare and wellness needs of our individuals, of senior individuals in San Diego and East San Diego in particular, but also improve the wellness of our community. So thank you, and with that, I'll turn it back over to you, Paul.
Now, please welcome June Esquerra. June is the primary author of the State of Seniors report. So she's also the director of programs for the foundation. And I promised earlier we were going to give out some money to some senior centers for their projects, and June is going to do that for us.
Hello everyone again, my name is June Esquerra. I am the Director of Programs here at the San Diego Seniors Community Foundation, and it is my pleasure to announce the Empower grantees to support our longevity program. The first grantee I would like to highlight is the Humboldt Highlands Community Center. Falls in East County are the leading driver of emergency department visits and hospitalizations amongst older adults in our community, in these communities. And for seniors in Jacamba, a fall can mean hours of travel just to receive care. That is why the San Diego Seniors Community Foundation is proud to support the Jacamba Highland Community Center with our innovative falls prevention program that weaves in feeling fit, staying active and independent for life, and Saving Claire project. Unfortunately, Saving Claire was not able to be here today, but they're also a grantee. So please help me welcome Maureen Phillips from the Jacamba Highland Community Center for Falls Prevention Program.
Can I make one? Sure. I would like to just make mention of the fact that this program would not have been able to be created without the assistance of the Growth-Mont Healthcare District and the equipment grant.
The next grantee is the Claremont Friendship Center. Sometimes communities show you exactly what they need. During COVID, when the Claremont Friendship Center was closed, older adults in the neighborhood came together in their parking lots to do socially distanced programs, physical activities, and socialization. Through their advocacy and this grassroots demonstration, the Kathy Hopper Claremont Friendship Center reopened in 2024. And today, our health longevity programs bring exactly what those seniors were looking for. Innovative programs and services that build community, mitigate social isolation, and empower older adults to redefine their aging journey. So please help me honor the Kathy Hopper Friendship Center and award Chrissy Finnick and Sharon Rose Moniger with a check on the center's behalf.
It should be noted the Song Family Foundation are the ones that have made all these grants possible to expand this longevity throughout East County and the county.
Thank you.
Congratulations.
Thank you. And last but certainly not least, Casa Familiar. Navigating benefits, medical coverage, community resources is fairly simple. And right now, with programs and policies shifting rapidly, it's more complex than ever. For older adults, trying to make sense of those changes alone can be very daunting, especially when it is not in a language that you're familiar or comfortable with. Casa Familiar has been a trusted source in South Bay for decades. Their bilingual resource benefit navigation program meets older adults where they are, in their language, in their community, and connecting them to benefits. Please help me welcome Maria Gamboa and Victor Alvarado from Casa Familiar to accept this challenge. Thank you.
All right, we're done.
Good to see you.